Hello, a very good evening to all of you. Sat Sri Akal, and welcome to yet another interesting topic, yet another interesting evening with Rajvin and Waran. Um, in this lovely in this lovely evening, in this lovely evening, uh, in conjunction with um, World Physiotherapy Month, September 25th September 2021, with the theme COVID-19 and long rehabilitation. This week, this month on Rajvin and Waran, um, we have a physiotherapist with us today, um, who is going to talk about physical physiotherapy management. He is none other than Mr. Jitinder Singh. Let's give him a round of applause, ladies and gentlemen.
Hi,
Hi,
Rajvin.
Jitinder.
Thank you for the lovely introduction. Good evening to everyone.
So, Jitinder, how are you today?
Great as always.
So are you ready to rock and roll,
Definitely.
answer the questions?
Sure.
So let's move on to the first question. Tell us more about yourself, Jitinder. Tell us more about yourself and your family.
Sure. Okay. I've been a physiotherapist in the rehabilitation and physio program for the past 15 years now. In fact, I joined in 2006. Time has passed so fast. It's now 15 years down the road. Okay. I've started my career in an outpatient physiotherapy clinic, and then felt that there was a bit more challenge that I required, and I went and joined a bigger establishment in Kuala Lumpur, where we used to have it was a big physiotherapy department with numerous other specialties like neurology, orthopedics, musculoskeletal, sports rehabilitation. It covers the entire physiotherapy practice that I needed. Um, Now, currently, I am managing a team of physiotherapists in a European-based company. Eventually, our idea and our long-term plan is to actually create a inpatient rehabilitation hospital. So that's the thing. And being the oldest among three boys has always been an exciting journey for me. Um, and for my mom as well. So medical or healthcare has always been the small narrow scopes that we traditional families will have, where you either have to be a doctor, lawyer, engineer, or else you know that's the scope for us. So that's where healthcare came in, and yep, 15 years of my life have been spent in this one, in this field. Now, for the past 3 years ago, I have been blessed with a very lovely, humble, down to earth, better half of mine, and now we are enjoying our lovely 1-year-old son, who is active and keeping me fit again.
Very
Yep.
nice to hear.
Thank you.
Um, right. Physiotherapist is a best profession, I would say.
Thank you.
Uh,
Thank you.
from my experience of going to UMMC to UMMC since 1995. So I have seen the physiotherapists got a lot of patients, and they really lift the patients up. And so far, what is the best moment that you've had in in your profession as a physiotherapist?
So far, the best moment I've had is being invited today on your Rajvin and Warren show. That really made me so happy, and I think this will definitely be one of the best moments of my life in this particular profession. Otherwise is to see the smile on our patient's face. Like what Rajvin you just said earlier, since 1995 you have been visiting the physio department. We are people who we're the people who bring the smile on our patient's face. You see, one of the most memorable moment was seeing a traumatic brain injury patient, secondary to a gunshot wound to the head. Right. So the guy was shot here, and the bullet came out here. He was brought in to us on a stretcher, on a bed, and he was bedridden for about 4 years. We used to treat him day and night, 2 to 3 times a day, Monday to Sunday. And I would say one of the best moments is to see him coming and shaking my hand after 4 years, speaking a few words. Yeah.
So we have before I proceed to the next question, we have a question here. Interesting question for you. Um, Sri 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 Devanayagi Parameswaran asked you that why did you become a physiotherapist?
Why did I become a physiotherapist? I would say the passion and the compassion in me felt that um, I can do a better service being a physiotherapist rather than any other healthcare careers out there. I don't want to see serious patients. I don't want to see blood. I don't want to see surgeries. I don't want to see people coming in and spending 5 minutes with me and going off. I like to talk. I like to spend time with my patients, and that's where I felt that physiotherapy is actually the best profession to do that, where you can have a good time chatting with your friends. Your patients who will eventually become your friend. Spend a good 45 minutes, 1 hour with them. So
Yeah,
it's yeah,
I
it's a
used
great
to have
profession.
fun. I used to have fun when I was in UMMC as well before COVID-19.
Great, great,
So
great.
um, physiotherapists are the best people in the industry,
Thank you.
and you are one of them.
Thank you. Thank you. Appreciate that. Thank
Um,
you. Christian.
the next question is like um, there have been a lot of misconception between physiotherapists and physical therapists.
Okay.
Is it the same?
Pardon? Is a gym?
Is it the same?
Yes, yes. In in initially it was known as physical therapy, right? Another, and in a few other parts of the world, a few other countries, they have changed the name of from physical therapies to physiotherapy. So eventually, it's actually the same thing.
Yeah. So I just wanted to know the there there's been a lot of misconceptions. So yeah. So
Correct.
there's a question from the viewer. What's the difference between a physio and a chiropractor?
Okay. A physio is someone who does physical therapy using various modalities. We have got exercises, stretches, strengthening. Whereas for a chiropractor, the chiropractor is actually based on manipulation and mobilization of the spine, of your joints, and it's quite a quick fix kind of approach, you know and whereas a physiotherapy process program is a bit more longer process where it covers a holistic part.
Yes, very good explanation.
Thank you.
Uh,
I'm going to
um,
offend the practice out there.
yes. I understand that physiotherapy there's a lot of areas. There's neurology and there's geriatrics and there's musculoskeletal. So how do you deal with different kinds of patients?
Different kind of patients, all right. I would say we always, for me as a physiotherapist, I always like to put the patient first. A patient comes to me having, having, some pain, probably a strain, um, some weakness here and there. Putting in a nutshell, the patient is already coming in with limitation, and to a certain extent, is already in some form of suffering. So I always like to put them first, get to know them, talk to them. I understand what they want. It's always the patients first. Then you got to understand, okay, certain patients are, they're very passive. They want you to decide everything. Whatever you say, they will just follow. They don't want to know anything else. They just come in, they'll do. So you need to know those kind of patients. Then there's another group of patients who are very skeptical. They will keep asking you a lot of other questions. They do a lot of research, like how Rajvin have done research. They'll keep asking you questions. They say, hey, I've studied this in YouTube, I've studied this in Google. Why is this like this? Why is that like that? Why are you using this technique rather than that technique? Why are you using this machine rather than that machine? So those kind of patients, you got to understand from where they come in, and you give them the facts and figure which they require. And then there's another group of patients that are flexible. Okay, those kind of patients, apa pun boleh lah. So for them, they are fine. And those are the patients that you can, they're quite flexible. That explains how. And the last group of patients here are those open-minded, exploring type. These are the types of patients that we have fun with. So there's whatever you have in your toolbox, you can try on them and see whichever works. Yeah.
Yeah, so there's a question from Prem Kumar here.
Sure.
Thank you, Prem. Thank you, Kumar Prem, for the questions. He's one of my friends, Facebook
Great.
friend, and also my yeah. So he asked you, what about osteopath?
Okay, so osteopath is another field, I would say, another branch of healthcare where they use certain visceral techniques. They have got their massages that they do. It's a different thing, but somehow when a patient experiences, they will feel that it's the same thing.
Yes. Uh, Thank you for the answer. I believe that stress is a stress is a stress is a friend. Most people treat stress as a friend instead of enemy. So, do you ever experience stress in your profession? How do you handle stress with patients?
Stress is something that we can never avoid. All right, numbers of patient, types of patient, the condition of the patient. Some patients come in with the intention of being cured at that one session itself. That's that's one of the most stressful time for us, when people come in and say, hey, you know what, I've got this neck pain for the past 15 years, and I want you to settle it in today, to this one session itself. So sometimes we get that kind of stress. Otherwise, we also have patients who are deteriorating in front of us. That's a different level of stress. So how do we manage stress is by keeping, like for me, how I manage stress is very simple. I keep the patient first. I put my 100% attention for the patient, and I don't multitask. If it's the patient and in front of me, that's it. I don't think of any other thing. The idea is to get the patient as comfortable and as satisfied as possible. So stress is something that eventually we will learn how to cope after some time. There's a
So,
question by one of the viewer. My son wants to become a sports physiotherapist. How to go about becoming one? All right. Okay, so the easiest way is for your for your son to actually visit those nearest sports clubs out there. They have got excellent sports physiotherapists that will definitely be your inspiration and people who you can look up to. So walk in, I mean, if, go into any sports club which you have. speak to the physiotherapist, follow them, get in touch with how they treat their patients, be involved in what they do. And if you like that field, then that's your field.
Yes, thank you for the answer. I'm sure he or she would be appreciative to you.
Welcome, welcome.
Um, can you explain some exercises for the different kinds of disabilities? Like
Exercise, different kind of physiotherapy.
exercise for different kinds of, different kinds of injuries. Some of it.
Injury. Okay, okay. So for us, it is always for us, the first thing will be to reduce the pain, reduce the inflammation. Uh, Thank you.
Yes.
Reduce the pain, reduce the inflammation. Then there's a lot of stretching involved, strengthening involved, keeping the patient comfortable, electrotherapy, taping, all sorts of things.
Have you heard of the word kinesthetic?
Kinesthetic,
Yes. What is that?
kinesthetic,
Yeah.
kinesthetic, kinesthetic is um, I don't know.
So
Kinesthetic,
also is also something to do with therapy, right? Kinesthetic.
kine, kinesiology.
Yeah,
It's
kinesiology. Sorry.
okay.
Kin-
Kinesiology is a field of what we call, it's a respective field and approach that we use studying the movement. In Canada, they like to use the word kinesiologist. Instead of physiotherapy, they will say this guy is a, or this person is a kinesiologist. So it's a kind of approach that you use where you study the human body's movement. Example, a footballer who comes to you, so he will say, okay, I've got limitation doing this particular movement. So we will record the person's movement. We will study each and every component, and we will fix based on give advice based on that particular component that requires fixing.
yes. Thank you.
Yeah.
So,
The
mm,
question by Charles.
Charles says that he's twisted his lower back and suffers uh, great pain when he moves. Now, he's not sure whether it's a spinal nerve or muscle injuries. Should I see a physiotherapist or chiropractor?
Okay.
So,
So, yeah, the first thing is if you have twisted your lower back and suffer great pain when you move. Number one is you got to reduce the pain. So you can reduce the pain at home by having analgesic creams. You can take a low grade painkiller. Ice therapy will help. Reducing movement at that particular um, angle that creates pain, that's something that you can do. And if you're not sure whether it's a spinal nerve or a muscle, okay, if it's a nerve injury, you will get a sharp shooting pain, you will get a radiating pain, you'll get a burning pain, you'll get a stabbing pain. Whereas for a muscle injury, you will feel warmness, you will feel aches and pain compared to the other ones, which I said earlier, the sharpshooting and all. And well, you can visit both, whichever that you believe, or whoever that is nearest to you. I would say if it's great pain like this, then a physiotherapist will definitely be able to help you. Otherwise, you can also give a shot to a chiropractor. See, compare and let us know.
thank you, Charles, for the question. Thank you, Jitinder, for the answer.
Thank you. Welcome.
Um, we will we will now move on to the next question, which is if you have an advice for a patient out there, what would that be?
Thank you, Mr. Jagdeep. You have been one of my best patients as well. Sorry, Rajvin, I missed your question.
Um, My question was, if you had an advice for a patient, what would that be?
Advice for a patient, what would that be? That's an interesting thing. I would say the first thing every patient got to do is understand that whenever you have a pain, it's your body signaling you through an alarm. It's an alarm. You got to find out what's really happening. Sometimes your body is, you are just too tired, you are exhausted, or sometimes you have pushed yourself too hard. You know, some people say, okay, I've been at home for the past 1.5 years. I want to get back in shape, and they start going back like how they were before the lockdown and whatnot. Keeping it in a summary, I would say harmonize with your condition, acknowledge your condition, acknowledge your pain, understand that, and be happy, grateful that, wow, you are still rocking and kicking because you've still got a pain. Um, Come and see us. We can definitely help you. Follow the whole process. Give some time, and it should be better. You've
There's a
got a good.
question from a viewer. He or she didn't state the name.
Yeah.
He, they said that I have a sharp shooting pain below my knee and sometimes it locks ankle. Can this be cured? Sharp shooting pain
Okay. A sharp
below.
shooting pain suggests that it could be a neurological issue where you could have a nerve being trapped at the lower back. All right. And usually, this pain, if it's moving from your knee towards your ankle, where your ankle is locking, it could be the nerve which is being impinged. So, you can definitely get a cure out of it for sure. It's just a matter of time. Allow yourself, relax your spine, allow yourself to relax, perform some stretches, keep moving your ankle, improve the blood circulation, and this definitely can. It's something that it's our bread and butter condition that we treat every day.
Thank you, Jitinder, for the answer. I now move on to the next question. What kind of exercise you need to prevent backache or knee pain or slip disc?
Okay, when it comes to pain, let's it's actually the managing pain itself is very easy. Number one, you got to warm up enough. Whenever you Let's start from the point of getting up from your bed itself in the morning. When you want to get up from your bed, before just jumping, offing the alarm, getting into the shower, and kicking the day, take your time, relax, open your eyes, move slowly, keep moving all the joints. Start by moving your ankle, your feet, your knee, slowly turn left and right, get the blood flowing. Sit down for a couple of minutes, perform deep breathing exercises, and then you start moving. For people who have got back pain, at the end of the day, it's a matter of stretching your back and taking away the load from your lower back. That's something that you got to do. Avoid sitting for long, especially for slip disc. Excessive fast movements are the cause of back pains. So take your time, relax, don't rush. Be present, and you will never be a patient for long. We have another question, Rajvin. Spur.
She, Sangari Krishnan is asking uh, for growth spur. That means your corn, right?
Yeah, a
Am
goat.
I
I
right?
think. Yeah, I think what she's asking is probably related to
Is
the
corn,
bone.
corn in the
It's
corn in
a
the corn in the leg? I think growth spur.
growth
That's what
spur.
I mean.
Okay, growth spur happens when you have got friction, continuous friction happening in between your tendon and your joint, your bone. All right. So most of the people will end up having a spur at their feet. Most
Yeah,
common is at the heel. So you can reduce the intensity of pain, but curing it itself, you can't really do much of things. Wear proper fitted shoes proper fitted clothing, avoid tight narrow shoes, tight narrow those body hugging clothes that prevents a proper movement. Your tendon needs to glide, your ligament needs to glide. Once you have that proper movement, you can avoid growth of this birth.
Thank you, Jitinder, for the answer, and thank you to the viewers who asked the questions. Very insightful. Before we move on to the next comment by Sheikh Rafli, I want to ask you this question: that what do you think is the quality of physiotherapy fresh graduates?
Quality of physiotherapy fresh graduates, it's individual. I won't say that they are no good. It's just that probably in the past few years we have got a lot of them, a mushroom of physiotherapy schools out there that have produced mass physiotherapy students. You see, so I would say that my advice will be go into a proper institution, get trained, practice as much as you can, and when you come out, try to get at least 6 months of hospital training. That will help you a lot for the fresh graduates. Okay, Rajvin, we have a question from a
Some
viewer. Some people say,
some people say physiotherapy is a myth, that their problem can be solved with one session. How much do you think? How much do you think, if it's not just physical but mind, body, and soul? Very correct.
okay, so this question is from a very interesting guy. He's got a good friend of mine. So, Mr. Sheikh Rafi, he knows better. Okay, physiotherapy is definitely not a myth. We started as physiotherapists and patient in 2013, and we are good friends till now. It is, it's how much do you think it's not just physical but mind, body, and soul? Physiotherapy is a holistic approach. You cannot go into a physiotherapy department not believing in physiotherapy. You cannot, they always say you got to believe in what you do, be present. Your mind and body have to be connected, and then
Yeah,
once a happy soul will definitely heal everything. So a physiotherapist is someone who will facilitate your healing. It is he or she is someone who will give you a bit of a homework to do, but most importantly is you got to do your homework. No one else can help you to do your homework apart from yourself. So, well, people can say what they want. It's a free country.
yeah. You can't stop people from talking, right? So, so
Another question.
before we go to Agenta Yong's question, I have a question to ask you: that what is the ideal ratio of the physiotherapists and the population?
Ideal ratio for physiotherapy and the population. Current back in 2014, there was one physiotherapist to um, 13,000 citizens, 13,000 population. Today we have got 1 to 1,700, which is a good move. I believe we must have a physiotherapist in every 50 people. So every 50 people should enjoy one physiotherapist.
Exactly.
We have this question from Agatha Yong.
Agenta Yong says that I have prickly numbness on right leg below knee, while still having feelings when putting pressure on. That means when she puts pressure, she has a numbness. So how do we deal with that? Even me, I experience numbness sometimes,
Okay. Yeah.
like cramps. Yeah.
Okay. This prickly numbness happens due to the lack of circulation. Prolonged sitting can be one cause. But looking at this, I sometimes most of my patients who sit with their legs crossed will actually experience such a prickly numbness. So it's important to change position, keep moving your feet, pump your ankle, move your toes. The rule will be 30 minutes of sitting down and 6 minutes of walking. So if you can follow that as much as possible, then I believe this prickly numbness will subside by itself. If it's not, then it's good for you to go in to consult probably a doctor to see if you have some other conditions. Sometimes some people have got diabetes, uncontrolled diabetes, and they also can experience such lack of circulation, prickly numbness.
Uh, Charles which usually says that how do I, since you're so inspiring in this industry from the half an hour we've been speaking, right? I've been saying that you're so knowledgeable and so inspiring. There are many people to come and see you right now. So
Sure, can.
Charles Charles is asking how to make an appointment to see you.
Sure. After at the end of the session, we will get Warren to type in my contact number and also my email address. Patients can come and otherwise, you can also follow me on Facebook. My name is already appearing there. You can type in this name and you'll find me. Be my friend there, and we can definitely find a way to get you an appointment.
Thank you, Jitendra, for the answers. I now move on to my
Thank you, Sukhil.
uh, second. Many
Thank you,
people
Ran.
are many people are telling you're awesome. You are, I believe so.
Yeah.
Uh,
Thank you. Thank you.
Many. I mean, we now move on to the second part of the session. Thank you, Jitendra, for the sharing.
Sure.
Uh,
Welcome.
before, before that, your friend Manpreet Aluwalia is asking which
It's my sister-in-law.
sister-in-law, yeah. Um, um, what's the difference of the acceptance of physiotherapy when when you first started to do
Okay, this is a beautiful question. Okay, yes. When I started physiotherapy 15 years ago, people will say, "Ha, that's the bone doctor walking. Ha, that's the guy who can do massages. Ha, that's the guy who can sort out my pain in one day." You know, uh, and then we used to be compared to people from the different alternative therapy where people will think they are sensei or bomo. People will say, "Hey, are you the guy who can set the bones and all that?" So what has happened is how we emphasize the importance in older generation is we got to go and understand what we got to see first of all, at from which background they come from which level of from what level of understanding they have. Once we understand that, then we go in and speak the language that they understand the best. So you know
Yes, thank
I hope
you,
that
Manpreet, for the question. You're right. She's so awesome. Thank you, Manpreet. I now move on to my second part of this session, which is sharing of my tips. I, as a finalist for Miss Amazing Malaysia Season 2 and a Laughter Yoga Leader, I believe that physiotherapy management is a, a management of pain without 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 with a little amount of medicine and pain relievers and uh, combination of stretching and walking, and um, other related exercises. I personally have been diagnosed with cerebral palsy, spastic quadriplegia since the tender age of 1. And my first visit to a physiotherapist was at the age of 1. And since then, there are very many different ways that I have learned to manage pain, especially recently. Let me just share how do I manage my pain, especially from uh, cramps and persistent muscle tension in the shoulder. Number one is um, I rest a while before after every walk. I rest a while because I work with the ambulation of the walker. Um, yeah. So and for those of you who are in pain, I would advise that do not control pain. If you have pain after exercise, like what Jitinder you said that apply hot or cold pack, and I personally do so, and do not and do bath with hot water if you have spasm. For those of you in the audience who don't know, spasm is a um, involuntary movement that happens when the brain and body do not coordinate, and hence uh, it is in in Malay. I'm gonna use Malay language here. In in Malay language, they said sudah putus, um, urat sudah putus. So they said that the connection is not there. So um, yeah. So how do we get the connection back? Is by uh, having a hot water bath and just doing exercise like how I normally do. Apart from that, eating a lot of avocados and relaxing, soothing and calming, um, soothing and calming foods is one of the one of the ways I normally do. Um, and also my secret is to do prayers and laughter yoga. And I believe that in laughter yoga, right, there is a song that every little cell of the body is happy, every little cell of the body is well. So in my laughter yoga sessions, I normally practice that. People enjoy it. So the next time the audience, uh, the next time your audience have pain, you just say that every little cell of your body is happy, healthy, and well. Apart from that, have a pain management journal. Uh, I call it like a gratitude journal or positive affirmation, and speak to uh, speak to a physiotherapist or patients with similar conditions. For example, if I am cerebral palsy, I speak to a actually I cover all the in my motivation and in my training I cover everything. I don't look at one scope because there's so many people calling me for like help. So I believe that you have to speak to physiotherapists or patients with a similar condition if you have to. Or if anyone needs any laughter yoga therapies, you can refer to me, or physiotherapists, you can refer to me. So um, the, we have a question here. kindly brief us how to heal pain through physiotherapy. I think I've already covered that, right?
Yeah.
Can
So,
you?
yes. Heel pain can be relief through stretches. You can do trigger point massages on the point that your heel feels the pain most. Keep releasing that point, ice it, stretch it, and usually the pain will subside.
Yes. So now, part number three, right? Everyone is waiting for, wants to know more about laughter yoga. Here I'm going to show you two exercises. One is pain relief laughter, right? You 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 like press the muscle, like you contract the muscle and you laugh at it. Ha 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 ha. For example, if you have pain here, right? You go ha 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 ha. And if you have pain in the joints, right? You go like ha 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 ha. Hold your whichever affected uh whichever area that you are affected with the pain. You instead of thinking about it
Laugh.
like you have pain, instead of thinking that you have pain, you actually laugh about it, and it's kind of
Excellent.
interesting. It's kind of interesting because um, the first time when I did pain laughter, I was like, "What is this?" I'm like, and then after sometimes, um, because I have been doing laughter yoga since uh, 4 months 4 months ago. I have been trained under Miss Legion. I think Legion is she's commented just now. The every little cell of the body is happy. So I've been doing laughter yoga since like 2018, and I got to know laughter yoga 4 months ago when I was certified as a leader in May 2021. Yeah, so that's pain laughter. The other one is hug yourself laughter, right? During this pandemic, right? You have you are feeling very lonely, and a lot of patients, right? They have a lot of for me, I used to have a lot of sinus, a lot of secretion in my chest. So what I do is like hug yourself. So it's like hug yourself and go ha 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 ha. Um, the other and then every time you go like very good, yay! And then we also have another four steps of laughter yoga, right? Which is clapping, breathing, and childlike play, and laughter exercise. I will go through three steps with you, with the audience. Like clapping is like ho ho ha ha ho ha ha ho ha, laughter yoga, ha 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 ha. Then you go very good, yay! The other one which will benefit, which um, it's like breathing technique, right? Breathing technique is like when you inhale, when you this one you can do in your office as well, right? In between a patient, right? You can uh, and I would advise everyone who have pain do that, right? You breathe in, stretch your hands upwards. You breathe in, deep, take a deep breath, and go ha 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 ha, like, and then the next, and then after every exercise you go like very good, yay! It's like a standard ruling for laughter, laughter, laughter yoga. And then the third one is like childlike play. Is like very good, very good, yeah. And then we have the positive affirmations. I am healthy, I am wealthy, and I'm blessed. And then we have the laughter exercise. Laughter exercise, I think we need another session to, because there are like 40 foundation exercise. Um, so yeah. So I have I believe that manage your pain today through laughter and joy. And thank you for listening. And be pain free and enjoy. Movement is joy. Joy is movement. Till then, till next time. Thank you for watching. Rajvin and Warren signing off. G, do you have anything to share?
Thank you so much, Rajvin, for this lovely night. Thank you, Warren, for all the technical support. Thank you to everyone who have participated. You know, um, I really appreciate your support. Thank you so much. Till we meet again, have a great time. Anything, you can call me or send me a WhatsApp. Be my friend on Facebook. I will try my level best to help you and take care. Till we meet again.
Thank you, Jitinder.
Welcome. Thank you.